technology has been around for 40 years. And it's the same technology that breaks up kidney stones, biliary stones, salivary stones. And so I sat down. He did a 3-minute treatment on me. It was probably the most painful thing I've ever experienced for that 3 minutes. And he kept saying to me, the more pain you have during this treatment, the better clinical outcome. And I was like, oh, okay. And when he finished, it was like, dude, where did my pain go? After 10 years, it was gone for 2 days. And I went home and I told my wife, this must be a placebo. Like something must have changed in my brain the way I was, I couldn't understand it. I had 2 more treatments over the next 7 days, and I literally was 90% better. I bought a device, and I didn't have to treat my wrist for 14 more months. I brought this to my clinic here in Atlanta, and we have a really niche clinic. We did chemo, diabetic, and peripheral neuropathy for the last 11 years. And I literally just started using it on my patients who weren't getting better with conservative care. And all of a sudden, in 3 weeks, some of the worst cases were now doubling their sensory nerve function. And I was like, hey, I think I'm onto something. And I told John Warlick at the time, I said, John, I think I can put one of these in every state in the country. And he goes, oh, if I had a nickel for that, I'd be a millionaire. And I said, no, seriously. And what I realized that after 23, 24 years of being in private practice and running a mom and pop shop and wearing so many different hats, where you're the marketer, you're the doctor, you're the accountant, you're the compliance officer, I realized that everything I had done up to that point really was a specialized knowledge that I developed, and I started like, oh my gosh, I'm gonna put this everywhere. And I started flying across country, and I was in some of the top clinics out in Seattle, and had 2 of the top doctors in a private equity group, and I remember them saying, no, this won't fly. You're swimming upstream, kid. You got a tough challenge bringing a new medical device into mainstream America. And I remember feeling so dejected, rejected, and just like, dang it. And I came home and I'd spent thousands of dollars to fly out there and thinking I was going to sell 2 devices to their 6 clinics, and my family almost had an intervention. Is this a therapy session? And they were like, hey, maybe you should just not